So you may speak. Anyone who wants to just contribute, I'm listening. Please start your audios and let me know what you guys think of this exam. What's the most difficult part or the part that's making you a bit anxious? What do you expect from this exam? Anyone? Yes, someone raised their hand. I'd like them to basically answer. You guys don't mind?
Hello, good afternoon, everyone. From
Good.
my side, ma'am, I'm expecting this exam to be just like, as you mentioned, the usual language exams, to be consistent of four parts. But what I knew from my surrounding friends that there are some parts which are difficult, more difficult than the others. For me, I think, يعني, personally, my issue is that on writing, I'm usually just forgetting the punctualities and I'm sometimes changing the places of some punctualities. So it depends upon the weak points of every one of us. I think the answers will be so much subjective. Everyone will see the exam from their own point of view.
Very true. Thank you for participating. Yes, exactly. Very true. Everybody, it's a very subjective answer. Obviously, some people will find writing easy, some would find reading difficult. So it just depends upon everyone. But these sessions are being conducted so that you guys, we can work on your weak points and help you guys ace your exam. It's a nerve-wracking exam, I agree. I know things can go bad on the exam day. That is why these sessions are here for you guys to know the tips and tricks and to go in the go in your exam centers and on exam day with a proper plan. But most of the people I've been teaching OET for a long time now, gave it myself as well. And the only difference I see with people who secure good marks as compared to the ones who do not is basically that they do not go with the proper plan. So that's what I keep on focusing in my all my sessions, that just go in the exam with a proper plan. If you don't know how the subtests are going to go about, what pattern the exam would be like, what instructions you're going to see on your exam day, how you need to rotate in throughout your exam, and what tips and tricks you need to have and need to know about before you go to the exam day. So that is basically the key. People who just show up in the exam centers, if they're very like if they have been exceptionally well, or most of the people do not end up scoring good if they just show up on the exam like this. Okay, so you need to always go with a proper plan and lots and lots of practice. So that's what we're going to focus on. These sessions will basically in these sessions, I conducted a few sessions in the last month, so you might all get all the presentations, so you can all go through those presentations. There are lots of tips and tricks that we've shared. If they tried doing sample papers as well. So in this month, we're going to do the same, and we're going to practice it more and more. So the people who basically joined us month back, they still have an idea. But the people who have joined us now, you guys, we're going to take you again from the scratch, and we're going to all be together in this, and we're going to also have one-to-one sessions. So anybody having any sort of difficulty in any subtest, we're going to try covering all that within your time limits. Okay. So it's a simple exam, but a bit technical. So you need to just have a good plan, some tips and tricks, and then you'll be good to go. Okay, you all are going to be good to go. So starting with the listening overview, I'm just going to give a brief overview today, not going into the details of things, but like always, like every subject, this part also requires lots and lots of practice. Okay, so now this part has three components. Okay, so you'll be listening to something, you're going to at the same time you need to comprehend that particular thing, you need to understand, and you need to write. So this listening subtest, the key is you need to answer it like at that particular time, right? It's not like this that your audio, once it ends, then you have time to answer. No, it's not like that. Once you're listening to the audio, you need to go about in the same pattern. Your questions will be in the same pattern as well as the audio, and you need to answer it at the same time as well. So you need to listen, comprehend, and write. Three things together. Okay. So this is going to only come with practice, and we're going to practice, and you guys will be very good at it. So just listen carefully, whatever audio is going to be played. Always remember that before the audio starts, there's always in all these exams, there's a context. What is the context? It's a simple line which states that, for instance, in case of a listening exam, in listening audio, there's going to be a context stating that a doctor is talking to a patient regarding this. So this is a context line. This context line is very important because it's giving you a clue that who is going to be speaking and who is the one the person is speaking to. So a lot of queries and a lot of questions would be answered automatically. Okay. Then there are a few tips and tricks which we're going to discuss, but this is the basic thing, right? So you need to listen to the instructions and you need to read out the instructions very carefully. Then there's a particular time which you need to, there's 90 seconds that are there before the audio begins. Those are very crucial 90 seconds. You need to go through your entire questions in those 90 seconds. If you use those 90 seconds very, very carefully and very productively, you'll end up scoring very good. But if you just waste those 90 seconds, so you might end up scoring your rest of the exam, right? And you need to practice. As you do more practice, you get better at it, so that by the time you sit for the test, you're all comfortable in utilizing your listening skills that you required for the test. Now, what's the listening test format like? You have three. This listening subtest is further divided into three parts. Okay, you have a listening part A exam, you have a listening part B exam, you have a listening part C exam. Now remember, in listening part A, you'll always be handed listening part A paper first, followed by part B and C. Part B and C for listening as well as for reading are multiple choice questions. Okay, where there's an OMR, where you have to just simply, sorry, not the OMR, you just have to simply encircle your answer from the options that they've given you, right? And like a simple multiple choice question, which you all must be used to with, okay, in your professional exams or in your board exams, anything, you might have seen multiple choice questions. So part B and C comprise of multiple choice questions, but part A are fill in the blanks or gap filled questions. Okay, now what is this? That in this case you have to write down your answer. So so this is where you need, this is where what I say is a plan comes in. If a person does not know the basic format of the exam, you would not know how to basically go about in your exam. So always remember, part A is gap fill questions, followed by part B and C, which are multiple choice questions. Okay, now what is the pattern of the exam? In case of listening part A, you will have two patient-led dialogues. Okay, so there are going to be two audios that you're going to hear where there'll be a doctor or maybe a physiotherapist or a pharmacist or maybe an optometrist, any health professional talking to a particular person. Okay, so when we're going to go in our detailed sessions, I'll also share all the context that you guys can get and the topics that you guys can get. But since this is just an overview, so I'm just touching upon everything, trying to touch upon everything. Okay, and you'll have a total of 15 minutes for this, followed by, so followed by part B and C. In part B, you'll have 6 dialogues or monologues. Okay, you're going to hear 6 audios, and after every audio, there'll be a question, and that question will be a multiple choice question. Then the second audio is going to start. There'll be a second question for it. Third audio, third question. Okay, so this is how it's going to go about. So I suggest, this is basically what I suggest, that you just spare 10 minutes for this part. And part C is a bit complicated for listening, where most of the people end up not scoring well. It's where they're too long audio presentations. Okay, so they're two long audios, and after the one long audio followed by 6 questions for it, then the second long audio, and then again 6 questions. Now this audio can either be a presentation, it can be an interview, it can be any topic, it can be anything. So it's basically pretty long. That's why people can lose their focus and they can forget the information. But I suggest to just try to answer questions as you go about, so that you don't mess up or you don't forget anything. So basically, this is what the format of listening exam is like. Now, right, so this is again just a brief overview. Part A comprises of 24 questions. There are 2 audios, 12 questions for each audio, and these question types are fill in the blanks type. Part B has 6 questions, 6 monologues or audio, followed by 1 question each, right? And simple multiple choice question. Part C, 2 long audios, followed by 6 questions each, and a total of 12 questions. These are also multiple choice questions, okay? So part A, as you can see, has most of the questions, and part B and C have 18 questions in combined. So basically, what I suggest to my students is that part A is very easy, You can easily score good marks in it, right? So what you can do is try to score the maximum marks that you can in part A, because in part C, a lot of people don't end up getting good marks. So just to be sure that you pass and at least get a B, it's important that you score most in your part A and B, and even if you mess up your part C, you'll be good to go. Okay, so total of 45 minutes are dedicated to your listening section, and their total of 42 questions, like I said, 24 for part A, followed by 6 for part B, and um, 12 for part C, right? And each correct answer is worth 1 point. There's no negative marking. Total 42 points are there. You need to secure 30 out of 42 questions. You need to get them right so that you get at least a B grade. And always remember, the questions are going to be from the extract, from the audio that's been played, and they'll all be from healthcare context because the healthcare professionals are giving this exam. So the context will always be healthcare oriented. Now, a brief overview of the tips. In the coming sessions, more tips will be shared, but since this is just an interactive and a brief overview session, so a few tips for the listening exam overall. Firstly, remember that a lot of medical abbreviations can be used in the audio. So just to be sure that you are familiar with them, obviously by this time, most of you are familiar with medical abbreviations. So if you're not, so then just make sure you're listening to a lot of podcasts or maybe watching for a few programs or maybe, or, seasons like Grey's Anatomy or maybe House or anything of that sort, or maybe listening to some medical related videos or podcasts or audios, because then you can get used to medical abbreviations. Okay, so it's important that you're used to medical abbreviations. And remember, spelling mistakes don't do now. There's no negative marking for spelling mistakes in case of listening exam. You're exempted. You can make spelling mistakes, but obviously to the extent that the other person, your examiner, can understand what you've written. Okay, if you've written completely abnormal sort of a spelling, and it's not comprehensible for the examiner, your marks would be deducted. But if something of the sort where just an I or E or maybe an O mistake is there, it's okay. Right, you need to be familiar with different areas of medicine and healthcare. So it's not necessary that most of the time, doctors get what a context where there's a doctor, but it's not necessarily, this is not, sometimes the context can change as well. So because they're just checking your listening abilities, right? They're not checking your medical knowledge. It's not an exam of medical knowledge, it's an exam of your listening skills, your language skills. So any context can be there. Maybe an optometrist is talking to a patient, okay? Or maybe a pharmacist is discussing something with his colleague. So it's not necessary that you are going to get the context because you're a doctor, you're going to get something in the hospital setting. It can be different because you need to just use your listening abilities well, okay? Um, Right. So then again, go with a plan in your exam day. Be familiar with the pattern, with the format of the exam. How much? Because in all of my sessions, I usually help my students. I give them a time summary that how do you need to utilize your time, how much time you need to give to this part, to this part, to this particular question, this particular question. So that will help you. You can also practice in that particular way when you're at home, and you can solve the papers in that way. So that time limit is very crucial. When on the exam day, when the clock is ticking right in front of you, your focus, your listening abilities, anything can be basically affected when you see the clock ticking and you're unable to listen or unable to complete your questions as you go. So it's very important that you practice within the time limit at home so that you don't end up losing or getting confused, because one little mistake and you'll have problem following the rest of the audio, because in listening you need to hear very carefully, right? The questions will be right in front of you, they'll be in the same pattern as the audio is going to be played. So if you just miss out one particular information, your rest of the pattern can get affected. Not necessarily, but if it can get affected, it's important that you just stay focused. Just don't see the clock or don't focus on the clock, because once you practice at home within the time limit, it won't be difficult for you to execute that on the exam day. And sometimes there can be some certain technical errors as well. So if you have any sort of technical difficulties, any sort of technicality issues are there because before the audio plays, they always tell you to test it if your headphones are working or not, or if you need to raise the volume or not. So if you have any sort of those issues, just remember to address it. Speak up, even if in between, if you don't hear anything carefully, or if something, if the voice breaks or any technical issues arise, just don't be scared to raise this concern. because like that way, if you're not hearing things properly, you'll end up messing your exam. Okay, and if you're unable to answer any question, just move on. Don't keep on sticking to that particular question, because once you cannot obviously, if something you've missed, it's better to move on than to just keep thinking on that of that particular question. And listen to lots and lots of health podcasts or videos. Now, particularly part A strategies, I can just discuss a few part A strategies, listening part A strategies. Now, I always tell my students to increase your prediction game, because always the question always tells you the answer. So if you see the particular, because in part A there's a fill in the blank, like I said, the patterns of part A is a fill in the blank question, right? So a particular word that's before that blank or a particular word that's after that blank will always predict you towards the answer. Just make sure you're underlining the keywords. When we'll be practicing, I'll tell you how to make sure what a keyword is and how to identify a keyword and how to underline it, right? So the keywords will always direct you towards an answer, whether it's a listening exam, writing exam, or reading. Sorry, mostly for reading and listening, your keywords are very important. Not for writing and speaking, but for reading and listening, obviously. So just make sure you're predicting the answer, okay? Before even the audio, if before when you hear something in the audio, just make sure you predict something so that your thoughts get directed towards something that you know that okay, I need to hear for this particular keyword, and that will direct you to the answer. Okay, so you need to have a proper plan. What word you need to hear very carefully so that you get an answer. I hope you're understanding what I'm trying to say. So the keywords, underline your keywords, predict your answers, look at the words before and after a blank are very important. So just make sure you underline them and hear them in the audio. Remember that a different what the question will not be the same. Sometimes they can use a lot of synonyms or a different structure. You can see a different structure in the question, and what they'll be saying in the audio would be different. Okay, there are different types of question as well, which we'll discuss later. But the point is that synonyms can be used. A question can be asked in a very different way, and whatever would be said in the audio can be different. So you need to make sure your comprehension abilities are very good. If you have the basic ability of comprehending English language, you can basically get an idea. You can get the gist of an audio. You can understand the gist of a particular line, and you'll be able to answer a question whether the same word is used or not, whether the format is same or not. Okay, so make sure you listen, read, and listen to different podcasts or read lots of things so that you are aware of different idioms, different synonyms, different structures of sentences, etc. And like I said, they can be collective words used mostly for part A. There is lots of collective words that can be used to represent group of words. Okay, so always remember this. And a very important strategy for part A is that always listen to what patient says. Okay, there'll always be one patient and the other would be any healthcare professional. So most of the answers would come from the patient side. So just make sure you're listening to the patient's conversation very carefully. The questionnaire or the healthcare professional will basically ask some questions. Okay, he will direct your thoughts towards that particular topic, and the patient is going to answer, and your questions are going to be derived from patient's answers. So just make sure you're listening to the patient side very carefully. Okay, and remember that the sequence of your questions will be according to the sequence of the recording. So don't get confused. If you miss out any questions, just leave it, move on. Now, this is a few preparation material that I find very useful. I like to share that with you guys as well. So there's a Matthew Smith's YouTube channel. There are 24 hours in any GP behind closed doors. These are basically a few listening audios or podcasts which can help you in developing your listening abilities regarding healthcare settings. Okay, so just make sure that you YouTube all these and get a basic idea just before sleeping, or maybe one podcast in a day, and you can basically build up your listening skills. You need to build up your comprehension, listening, and writing skills. So just make sure whatever you're listening, you're comprehending, and then you're writing down the keywords so that you can just practice a bit before the exam. And the headings and information that will help you decide, like I said, the keywords in your questions as well. So when you look at that, that will help you decide what you need to particularly listen for. You need to predict what type of information or word will go in that particular gap, because some of your common sense also comes into use. So it's important that you're using all your senses and your previous knowledge very well, because some questions can have a very simple answer which can be easily predicted by your own healthcare knowledge. So just make sure you're using all your abilities to the maximum on your exam day. And role play consultations, like I said, like you have role play consultations for the speaking exam, you can do that as well with any of your colleague and or your any study partner, and this can also help you practice for part A. Right. A few strategies for part B. Then again, this is an example of a question where it's basically you hear the questions, the instruction is you hear a nurse explaining wound care to a patient. What does she explain to the patient? Now, the first line is basically the context. The context is the line which is basically telling us who would be speaking and what that person would be explaining. So the entire concept or the entire audio is based on this particular context, and the person like in this case the nurse surgeon, so you basically get an idea when the audio says that who is actually there can be two people speaking, three or more than that. So when but most of the time there are two people who are there. Okay, so when they've given the context about a nurse speaking, so you got an idea that okay, I need to listen to the nurse part very carefully because my questions will be derived from her part and she'd be explaining wound care to me. So I need to hear things regarding wound care. This is how your thoughts will be directed. So just make sure you're basically reading the context very carefully. Then secondly, you need to understand the question. The question basically will direct you to the answer. If you get a good comprehension of your question, you can easily predict the answer. Now the question says, what does she explain to the patient? Now you need to focus on what is she explaining to the patient. Is she explaining the dressing, how to manage the dressing at home, why the dressing is used at home, or why alginic dressings are used at home. So these are three different whys in house. Okay, so you need to make sure what basically the nurse is saying in order to choose one of the options, right? And thirdly, you make sure you're seeing the differences in the options. Sometimes two options can be more or less same. They can look same to you, but obviously they can have two different meanings. So just make sure you don't get confused between the options. Read the options and differences very carefully, and you need to listen to your audio before marking your answer. Okay, because in part B, like I said, there's just one question and your whole audio is once you're there's six audios and there's six questions. So once the first audio ends, there'll be question one. Second audio is but you need to answer while you're listening, but it's better we just write down the answer next to you or select an answer right next to you and make sure you've listened to the entire audio before you insert that. Remember, there are 90 seconds before every audio starts, so utilize that time to read and go through your question and to go through your answer options as well, so you see the differences that are there. A few study tips. Basically, practice a lot. If you're working in a hospital setting or maybe in your workplace, whatever your workplace is, just try to speak English over there. Try to ask your colleagues to basically check your listening abilities, maybe give you a scenario, maybe talk to you, maybe you can ask them to help you out in some way or the other. Share lots of idioms or synonyms with each other. Watch lots of healthcare training videos on the internet. Create a list of words that you commonly use in the workplace so that you get an idea. Even if you don't do this, and you just go through our sessions, practice a lot, do lots of sample papers, you'll be good to go. Now, coming to part C breakdown, I hope you all are with me on board, and till now, all things are clear. Any questions till now? Or shall we move on? Okay, no questions. We're going to move on. So part C is basically part C is a bit complicated. When we're going to come to part C, you get an idea. But just remember for now, 2 long presentations followed by 6 questions each. Questions are multiple choice questions, but the audio is pretty long. So just remember in the audio you need to, and the questions that arise from that audio can be very different as well. So they can be lexical questions, they can be incomplete questions, they can be just questions. So 3 different types of questions can be there in part C. So you just need to understand what the main idea for communication is, what the gist of the communication or the audio is, and a few opinionated questions are also there in part C. So we'll discuss all of that in detail when we go for the part C session. But remember that you need to listen and listen to the audio very carefully, keep underlining the keywords. While you're listening, focus on the main idea of the communication, see for any signal words, any particular words that the speaker is using, which is different from the rest of the audio, because that is going to point towards an important answer. Look for synonyms, look for different structures, try to rule out incorrect answers as you go, and try to answer the question while the audio is played, okay? There's just a few tips, but when we'll be actually doing part C, you'll get an idea how complicated part C is. There are very different type of questions that you can see in part C, but if you're going to practice it, obviously it will be easy for you. Right. So a few strategies, just read, listen, read, listen, read, listen. This is what I said. You need to read a question, listen to the audio, comprehend the information, read again, and then write down your answer. Follow the talk, match it to your question and audio. Any sort of this, lots of distractors would be there. I'll tell you later on what distractors actually are with certain examples. So a lot of distractors are there in questions as well as in the audio to change your direction of thoughts so that you end up choosing the wrong answer. But if you have a good comprehension of English, it won't be a very big of an issue for you. Use your background knowledge as well. Sometimes your background knowledge can help you answer a few questions, okay? And lots of common sense comes to help as well. So you need to use your common sense as well. Self-study tips, listen to lots of presentation and podcasts. There's a few I mentioned over here. Practice listening to longer talks, especially for part C. Listen to a variety of audios and healthcare topics for opinions of speakers, opinions and speakers' attitude, and practice lots of unfamiliar content and vocabulary. Okay, and it's always good to listen to new stuff and learn and add into your vocabulary, because anything can be used that particular day and you cannot complain later on, obviously, because it's an exam and an exam can be tricky. So just make sure you go with the plan and you've practiced a lot, because your practice is going to be very helpful for you. Coming to the reading test format, before I start reading, any confusion regarding listening that you'd like me to address? Any confusion, any feedback from your side? Anything you guys want to add for the listening part? Are you all with me, or okay? So it's clear. Okay, great, it's clear. So obviously it was just an overview session, but once we are going to be going to the detailed sessions of every subtest, things are going to be very, very clear to you guys, and everything is going to then make sense to you people. So inshallah you'll have good learning sessions. Right, coming to the reading test format, like all the subtest, reading part also has three sub parts: reading part A, part B, and C. Again, part A, you get paper for part A first, and once you're done with part A, then the paper for part B and C will be handed out to you. Part A, again, it comprises of three sort of questions. So the first set of question is basically um, where there'll be a particular line or maybe some information, and they'll ask you to write down which paragraph or which which paragraph this particular information. So there'll be four texts that will be in front of you for part A, okay? Right, like there'll be paragraph A, B, C, D. So you need to write down what particular paragraph has this particular information. So this is the one sort of questions you see in part A. Second sort of questions you see in part A are again incomplete questions or incomplete sentences where with the word you need to fill in that blank, okay? And that particular word is coming from a particular paragraph that they've given you, from the particular text that they've provided you, okay? So you need to fill it with the exact same word. You don't have to add things from your own side or maybe write anything from your own side. You need to complete it with a word or maybe a phrase, one or two words, but it should be exactly from what a word or phrase that they have particularly used in that text. And the third sort of question is again fill in the blanks or short answer questions that you can call it, or fill in the blanks where simply with a word or phrase you need to complete that particular sentence as well. So these are the three set of questions you see in part A. In part B, six short texts there. So one text followed by one question, that is going to be a multiple choice question. Second text followed by a second question, that's also multiple choice question. Third, fourth, and fifth, sixth. So this is like this. There'll be six text and six questions for each, and one question for each. So a total of six questions. And part C would comprise of two long texts. So there'll be two long paragraphs or two long texts, and there'll be again multiple choice questions, six questions for each text. So this is the basic format for the reading part. Okay. All right. So there'll be a total of 15 minutes for part A, and there'll be a total of 45 minutes for part B and C. Now, just an overview of the reading subtest. Now, reading part is an expeditious reading task, okay? And what they're checking is your ability to skim and scan through the different text notes. So basically, for part A, what you have is that there'll be a topic written on top. For instance, I say the topic is PCOS, okay? So, or maybe burns. The topic is burns. So the topic will tell you what the four texts would be about, okay? There'll be four texts that will be there in front of you. There'll be text A, B, C, and D. Get it? Now, all the four texts will be different from one another. But the topic overall, the topics and the topic is burns, so things are going to be related to burns. Now, text A might be just a simple, may comprise of a simple definition of the burns or maybe classification of burns. B would be something regarding the, you can say, management of burns. Okay, C can be about any specific, like a classification, like they can be, any information like how to calculate the percentage of burns, how to treat a person with a special particular case of a burn or something of that. And D can be something like a visual illustration, maybe a table, maybe a graph, maybe certain drugs can be there. So all the four paragraphs are going to be okay. So all the four paragraphs are going to be different from one another, but they'll be different from one another, but the context and the overall topic is going to be same. So maybe the first paragraph would be a general overview or maybe classification of burns. Second would be management. Third would be treatment options. Fourth would be something in tabular form with this. So remember, you cannot go through since your time is very limited in part, you just have 15 minutes to do this. You cannot go through each and every word of all the four texts and then go through your questions as well. And the questions are so long. So what is the trick for part A? Skim and scan. You need to skim through the text, comprehend. Skimming means to just read quickly while comprehending the information that's right written in front of you. So you need to practice. This will come with practice. So skim and scan. Just skim through the text and scan for important words. Words are the keywords. So you need to scan for the keywords and keep underlining those keywords. Because those keywords are the words from where questions are going to arise. So remember, the keywords you need to underline, you need to skim through the text, and you need to also look out for things that are different from the rest of the text. Anything written in bullet form, italics, bold, numbers used, figures used, any graph used, make sure you just look over those particular parts. Okay, and you have to complete 20 questions in just 15 minutes. So remember, you can do this within time if you've practiced very well this technique of skimming and scanning. And you need to also understand the different medical text types, the different numerical textual information. So the more sample papers you do, the more you go through different sort of articles, even out of the medical context. If you just go through one article every day and practice the skimming and scanning technique, you will be good to go. It'll be easy for you to basically increase your reading speed, because most of the time reading speed is not, we don't have such we do not have such speed. We cannot just go through such long lengthy texts and comprehend at the same time and then also write down the answer. So this is just with practice you can just ace this part. And it's important you secure most in this part because the marks are absolute in this part. So in part B, C, some sort of confusion can occur because of multiple choice questions and similar answer options. But in part A, you need to write an absolute answer, so you can score very well in this part. Then part B is checking your ability to understand the detail and gist or main point of a complex text in a healthcare workplace. So you'll have 6 texts in front of you, followed by 1 question each, and you need to take out the major purpose or the gist of that particular text and pick out for any technical or any complex information they've provided you. So you need to identify specific ideas at sentence level, because the questions are going to be derived from those ideas. They can be opinionated questions as well, asking your opinion or maybe the writer's opinion, okay, and or maybe a research conclusion or something of that sort. So any complicated text would be there and the question would be derived from that particular text. So you need to answer that by just by just skimming and scanning and getting the overall gist of that particular text. Okay, I hope you're getting the point. So this is what text B is all about. That your sorry, part B is all about. It's checking your ability to comprehend complicated texts or complicated written information. And part C is taking your ability to understand explicit or implied meaning as well as attitude or opinion present in a long written. Now part C, like the part C of listening, this part C also has very long reading. You can say they're very long paragraphs. There'll be two very long paragraphs, and you can always lose track because the paragraphs are too long. So what the key is, again, skimming and scanning technique will help you ace part A, part B, as well as part C. So once we're going to do the sessions, you'll get a better idea. But in part C, the text paragraph is very long. So just remember, you need to skim and scan and underline the important keywords. Identify the relationship between ideas at sentence and paragraph level, how different paragraphs can be interconnected, what's the opinion of the writer, what's the gist of a particular text, what's the purpose behind any sort of a reference or maybe any complex phrase. And lexical questions or lexical references are very common in part C question. So all of that, you need to do as much sample papers as you can so you get an idea of and you get the basic, you know, you have a know-how of how to basically solve your part C and what things you need to particularly look for and how to answer your questions. So this is what part C is all about. So part C will have very long paragraphs. Just remember to skim and scan and get the basics of every text and just don't lose track in between. This is a few time management summary which I made regarding part A, because you can just skim through the four texts in 2 minutes, match the questions and do the matching questions one part in 3 minutes, sentence completion 5 minutes, and the short answers in 5 minutes. But we're going to go in detail when we'll be discussing part A later in later sessions. Top tips for the reading task is the headings. In reading task, the text will always have a heading. So the heading will direct you, the questions will also direct you towards the heading, especially for part A, the first set of questions that come where you have to match the question with the text. So remember the headings will come into play and the keywords you've underlined, because then obviously you don't have to go through the entire four text. You get an idea that this particular sentence is coming from which text. So you'll just write down that text number in front of that question. Okay. Again, use information keywords that are provided in questions to help you. The questions, a different sort of a word or maybe a different question type or a keyword will I always direct you towards an answer. So just make sure you've underlined that in question as well. Move on if you've gotten stuck. If you get stuck, practice skim and scan reading, and also again in your daily life. And just make sure you know all sort of medical abbreviations, and spellings are very important. Okay, in reading part A, in less like in listening, you spelling mistakes for example, but in this case they're not. So remember, you need to write the correct spelling as well as exact same word, and don't write anything from your own. Don't write synonyms, don't write any phrase that you've made up yourself. You're supposed to write the exact same word. You have to pick up the exact same word from the text and you have to write it in that particular blank for part A. Obviously for part B and C they're MCQ, so you don't need to worry about the spelling mistakes or anything of that sort in that case. But for part A, you make sure you're just writing the exact same words and using the correct spellings. For part B, remember the question, you need to understand the question very carefully to get the text, to understand the context, because obviously the question will always direct you towards the answer. So the questions can be a bit complicated, but if you have good comprehension ability, you'll always choose the right answer. Underline keywords and options, read the text, look out for links and options to the options, and you need to be careful for distracted. Distracted are synonyms or maybe words that can just change the meaning. So you might be thinking that, okay, this can be an answer, but once you're reading the question, there can be certain word that's used which the meaning of which is totally different. Sometimes a word can have two meanings, but you have to make sure by using your comprehension abilities that what meaning they're basically asking you to look for. So all of this would just come with practice. Right now, we're just telling you all, and all of this, nothing will make sense. Once we go on board and start practicing things, then things will make, and share examples as well, so things will become more clear. Since this is just an overview, so I did not add anything much in it so that you guys will get confused at this level. When we're going to do each subtest on one particular day, in one particular week, the whole week would be dedicated to that particular subtest. Things will make sense to you all. In part B, again, read the context carefully, notice difference between the options, be careful of distractors, practice reading policies, the instruction manuals, and research articles. They're going to help you a lot. For part C, remember skimming and scanning technique. Remember to number the paragraphs for your own easiness, for your own ease, and you need to approach each question individually because every question is going to be different from the previous one. No question will be linked to the other. And understand the longer part of the text. Practice reading longer text as well. Read the question stem very carefully. See the options differences. If you see any sort of distractor, make sure you know how to identify an distractor. And if you there's few useful websites where you can see long articles, presentation researches, which can help you help you get an idea about what sort of what sort of paragraphs you're going to get. So manuals, policies, health policies, research articles, figures, some guidelines for a particular management of a particular disease, all of that can come in your party. So you need to read extensively, you need to read on a variety of medical topics, you need to build your stamina, and you need to build in your vocabulary, okay? And it's better if you guys start building your vocabulary from now on because then it'll help you later as well in your exams. You need to remember to get the basic concept or gist out of any text. You need to get out the gist or the main idea, and you need to summarize the main idea of each paragraph in 2 to 3 sentences for your own ease because this is going to then help you out later. Okay, so this was all for today's session. I would like you all to please let me know your feedback. What you guys how was today's session? Did you guys get an idea? You've got the main general overview. Were you all with me? Did you guys get what I was saying? Did you guys get the brief overview of the two subtests? Any confusion, anything you want us to focus more on in regarding listening and reading parts? Any feedback you'd like to give me right now, which can help for the later sessions? Thank you. What about the new participants? I'd like them to give me a bit of feedback. Did you guys get a general overview? Okay, thank you so much. Anything you guys would like to ask me before I sign now? Okay, so the writing session, Dr. Sara is going to she'll join after I end the session. She's going to basically tell you about the writing part and about the live practice on official tests. So we usually do that in our every subtest. We practice the sample papers on the website as well as the materials that we have bought from different resources. So we're going to practice. We always make sure whatever subtest we are doing, we're discussing, we always practice it, and we also give you homework. So since today was just an overview session, we did not add any of the practice papers or any particular thing of that sort because it will just create lots of confusion at this point. We just go about in a way that one particular week is dedicated to a particular subtest, and then I give a presentation about that particular subtest followed by sample papers. We practice together. We make sure everybody is on board and everybody gets a chance to answer, and we don't move on unless unless everyone is clear about things. So we'll be just doing sample papers together. So don't worry about that. We're going to practice a lot of sample papers and you'll all be very good until the end. For the speaking session, Sara is going to basically tell you about any queries that you have regarding the speaking or the writing part. She's going to address. But if you have any queries regarding the reading part and the listening part, please let me know before I end my session. Okay, so thank you very much everyone for joining. I hope you guys, I'm looking forward for you all to join my next sessions as well so that we can practice and learn lots of new skills for OET listening and reading. Thank you so much for joining today's session. And until next time, let my team know for any feedbacks or any queries, and we'll always try to address that. So don't worry, we're here to help you guys, to facilitate you guys. So just let us know for any sort of problems or difficulties that you have. Okay. Okay. So I'm going to conduct more sessions for you for Part C reading as well. Just don't worry about that. Thank you, everyone. Till next time. Take care. Bye.
Okay, so the first module we're going to discuss is the writing part. That's the most challenging part of the OET for some people. There are a few tips and techniques which we have to follow for the writing and specifically the speaking part. First of all, what is included in the writing part? The task which is given to you in the writing part of the OET letter is you have to write a letter from the case notes given to you, and it might be a discharge letter, it can be a transfer letter, and it can be a referral letter. So any of these three letters can be asked. This is a sample of the writing case notes given to you. So this is a sample of the doctor's case notes, the writing part that is for the medicine category. And you have to arrange these notes into formal statements, and you have to write a formal letter. The things you have to focus on, some of the things are, you have to be very, very specific. That means no extra detail should be included in your letter. The first thing. The second thing is you have to take care of the word count. So the body of your letter should be in between 180 to 200 words. If you're exceeding 210 or 220, so 210, if you're exceeding it, you will lose your scores in that. The second thing is you have to use a formal language. So no informal word should be there in your letter. The third thing is you don't have to include irrelevant details. You have to be very specific. And this is only what we are going to learn in the course. How do we have to take out the specific information and what information we have to take out to include in our letter. We don't have to write all of this in our letter. We have to take out some specific information. So the three most important things and the arrangement of the letter. First of all, the addressing, then the salutation, then the introduction. What things are included in your introduction? What things are included in your first body paragraph, your second body paragraph, and how do you conclude your letter? So that is the complete structure of your letter, which we are going to learn in this course. So here are some of the statements which we can use. These are the formal statements which are commonly used in your writing. There are different statements here which will help you write your introduction, especially for each type of letter. For example, if it's a discharge letter, you can start with, I'm writing to refer Mr. X who has been diagnosed with this. She is being discharged today and require your assistance to resume her daily activities. So this is your introduction. So introduction is about 3 to 4 lines. It shouldn't exceed your 3 to 4 lines. So that is the arrangement or the structure of the letter. Second, for example, we have an urgent admission. So we can write, I am writing to refer Mr. X who requires urgent admission to your hospital due to severe left-sided headache. I'm writing to refer Mr. X who is recovering from pneumonia. He's discharged today and requires ongoing care and support. So this depends whether it is a discharge letter, whether it is a transfer one, whether the patient needs ongoing care, whether it is an urgent admission to the hospital. So the statements are used accordingly, and even the structure of the letter is different for referral, it's different for discharge, and it's different for the transfer letter. Introduction almost remains the same. The information in the introduction remains the same, but remaining paragraphs, the structure is different. Okay, if it is a suspected case, no definitive diagnosis is made. So you can use the statements like, I'm writing to refer Mr. X, who is presenting with signs and symptoms suggestive of acute pancreatitis. She requires future assessment and management. So this is when you're not given a definitive diagnosis. If it's a known case, I'm writing to update the current health status of Mr. X, who is recovering from a left total knee replacement. He is being discharged from our hospital back into your care and requires continued care. So these are the most helpful statements which you can use to form your introduction of your letter. You are given 45 minutes to complete your letter writing. 5 minutes are for reading and 40 minutes for writing. That is, the first 5 minutes you're not allowed to write. And remaining 40 minutes, you can start writing the letter. For the next paragraph, some of the statements for the body paragraphs. For admission case, Mr. X was admitted to our hospital 3 days ago for a left hip replacement. Multiple visits initially presented to my clinic with an injury on his left knee. Management statements and X-ray was done which revealed fracture of the femur. Certain blood tests were ordered or requested. We don't have to write the detail of the blood tests. We can just say they were requested and we can explain the reports. What were the reports of the blood tests? His pain was relieved by paracetamol or with paracetamol. His wound healing is well with regular dressing changes. So these are some of the statements which you can use for the management criteria. We have to take care of one thing, that is use of passive voice in our statements. We have to avoid as much we can. We don't have to use the active voice. That is, I prescribed my patient with paracetamol. I prescribed paracetamol to my patient. Instead of writing this, I can write paracetamol was prescribed to Mr. So-and-so. Or I can write Mr. X was prescribed paracetamol. So these are the passive statements. So try to write as many passive form statements. Try to avoid the active voice because passive voice is used for the formal letters. It's for a formal language. Next, for the progress. Post-operatively, he made good progress. Despite intensive care, his progress since admission has been poor. So use of present perfect tense, that is the grammar part of writing. When we start with the course of the writing part, we will be discussing all the grammar rules which are important for the OET writing, and they are the use of tenses, the use of prepositions, and many others. And the tenses mainly used in the letter is like most of the time perfect tense is used. So has been, that is, so instead of writing she is feeling unwell, I can write she has been feeling unwell. So take care of these tenses. He's able to walk short distance without any assistance. So these are the statements, sample statements for writing for the progress category of your letter. Now, if you want to mention about the patient's habits of alcohol and smoking, his alcohol intake is higher than the recommended level. Normally, we don't write this way because most of the time we are given how much alcohol the person is taking. So we can write he consumes this much of alcohol, or he's a social drinker, or he consumes alcohol. His alcohol intake is high. Okay, he was advised to reduce alcohol consumption. He was advised to reduce alcohol consumption. So this is again a passive voice statement. For smoking, he smokes in excess. He smokes 20 cigarettes a day, whatever information is given to you. He has a habit of smoking and consuming alcohol. He has been smoking for last 5 years. This is a very important statement. Now there's a slight difference between the use of for and the use of since. Maybe most of you might be aware of this, but some of them, they don't know the difference mainly. This is also covered for the grammar part, but let me tell you a major difference. For is used when you are given a duration, and since is used when you're giving a specific time. For example, for last 5 years, duration, for. And if it's like since 2018, a specific year is given to you, then since. So this is also counted as a mistake if you use for instead of since. Next, he is overweight with a BMI of 32. This is a very common statement. You can write in your letter if the person is overweight, because the weight is given, mostly the BMI is given, weight is also given. So you can simply write he is overweight, or you can write he is overweight with a BMI of 32. If the person has diabetes, Mr. X has type 2 diabetes for which metformin was prescribed or is prescribed, depending on the time, if it's past or present. She has had hypertension since 2011, has a history of diabetes and hypertension. This is a very common statement used to write the history of the patient. Or if the patient has a family history also, we can write he has a family history of diabetes. So for which metformin was prescribed. Besides this, along with this, so these are some of the words which you can add to your letter in addition to add more information. So these are also some of the words which you can use to structure your letter. Okay, the next thing is recommending paragraph. That is your last paragraph or the concluding paragraph. It would be highly appreciated, or it would be appreciated if you could ensure she follows her exercise program and maintains a healthy diet. So we normally start with it would be highly appreciated if you could, then add your purpose, whatever the purpose is from your question. I would appreciate if you could monitor his pain status for which Panadol can be administered. So whatever the purpose is, you have to write in the conclusion part. She'll be reviewed by the neurologist. Your assistance is inevitable in her treatment. So you can use any of these statements to conclude your letter. Your word count starts from the introduction. That is when we start, I'm writing to refer this and this, starts from there and ends in the recommendation paragraph. So your addressing, salutation, and your closing is not counted in your word count. So that body of the letter should be 180 to 200 words. And it should be very clear for the reader to understand what you have written. It should be very easy to follow. And whoever is reading the letter should understand, like, if it's like multiple visits are mentioned, it should be very clear, like at which visit what happened, and then what was the treatment given to the patient. So we have to just follow that order. You have to take care of that order also. So this is all about the writing part. Okay, next coming on to the speaking part of OET. In the speaking part, you're given 2 role plays per exam, like one candidate will get 2 role plays. You're given 3 minutes to prepare for the role play, and 5 minutes, the role play will last for 5 minutes. Again, the second role play preparation time is 3 minutes and it will last for about 5 minutes. Now, role play depends on writing and speaking, both are profession specific. For example, you are a nurse, it will be given to you according to your profession, nursing profession, writing and speaking, both of them. Doctor, if you're a doctor, it will be given to you according to your profession. For example, you are an occupational therapist, a pharmacist. So all it depends on your profession, what profession you are in. So if, for example, you're a doctor, you will be given the role play of a doctor. You have to play the role of a doctor based on the given points. The task is already given to you. There are points written on it, and the points are already given to you. You have to make those points in the form of your speaking, in the form of proper sentences, and you have to communicate with the examiner, that is the patient. So the examiner will be the patient and you are the doctor, and you have to play the role of a doctor and take it for 5 minutes, whatever the task is given to you. Now, the most important things for speaking, first of all, your introduction and your ending is very important, the way you start and the way you end. Secondly, your pronunciation, your fluency should be all correct. You have to cover all the points given to you in the task. You don't have to miss any. If you miss one point, you lose your score. So you have to cover all the points, the most important thing. Next, we have some of the other things where we are given the scoring. That is, first of all, sympathy. You have to be very sympathetic towards the patient, and you want the patient to know that you are feeling sympathy for him. You have to understand the patient's condition. So first of all, the introduction. Good morning, good afternoon. My name is Dr. So-and-so. I'm your treating doctor for today. How can I help you? Or, nice to meet you again. How can I help you? So any of the statement for the introduction. You can use any of them. Sympathy, I'm so sorry to hear that. It must be very painful for you. It must be very stressful for you. I can understand your worries. I can understand it might be a stressful situation for you. So there are a list of statements we have for sympathy. In one role play, at least the minimum is two statements, at least sympathy, or you can go to three also. So 2 to 3 sympathy statements should be there. The second most important thing is questioning, asking the patient again and again, or like you have to communicate. You don't have to play it as a speech, you have to act as a communication. It's a two-way communication. So ask the patient in between, do you have any more concerns? Is there anything else bothering you? So this is the questioning part of the role play. The third most important thing is checking for understanding. That is, if you're explaining anything to the patient, for example, I explained to my patient any of the management or treatment techniques, like you can follow this methods to treat or manage your pain. Are you following me? So are you following me? Am I clear? All these statements are checking for understanding. So I'm basically checking the understanding of the people, of my patient, whether he's understanding what I'm trying to explain or not. So these are the three most important categories where you're scored on. Other categories include your fluency, your pronunciation, and your task completion, and your time also. So 4.5 to 5 minutes, in between 4.5 to 5 minutes, you have to complete your role play. Okay, next, coming on to the history part, when you want to take the history from the patient. So when you start, how can I help you? The patient will be telling you the concern or the main problem. I'm really sorry to hear that, but can I ask few questions before proceeding further? May I ask few questions if you don't mind? So that are the history questions. And history questions are always taken from the role play. You don't have to form, maybe one question you can form from yourself, but use the information which is already given to you. You have some background information given to you that the patient is suffering from this complaint since maybe these months or these days. So you have to utilize that information only and form your speaking part. So utilize the information given to you in the background of the role play and form your history statements. For example, if the patient is complaining of pain, then I might ask, can I ask you some questions if you don't mind? Is there anything which makes your pain worse or relieves it? Right? Then, have you experienced any other symptoms along with your pain? So these are the history statements, but I have to take these out from my case notes only, my given notes only. Okay, does anything seem to bring it or on aggravated? Location, can you tell me where it hurts? Where exactly is the pain? Could you tell me where the pain is? So these are the questions for asking for the location of pain. Duration, so these are all pain related questions. Duration, how long have you had it? Severity, could you describe the pain for me? Or else, if the patient is in pain, one common question you can ask is, can you tell me the pain severity according to a score of 0 to 10, 0 being no pain and 10 is the most worse? Can you give me a score? So in that case also you get an idea like how much pain the patient is in. Apart from this, what other symptoms have you experienced? Right? And have you tried any medications or have you taken any treatment for that? Okay, so this is for the history part. Next, coming on to the diagnosis. Based on the symptoms and based on the examination, you have to tell the patient what is the diagnosis of the patient. Not always, but most of the role plays for the doctor especially, the diagnosis is mentioned on the task given to you. So well, based on your symptoms and after examination, I believe that you have what's called dash, and let me explain. So for example, the patient is diabetic. So I believe that you have, or the patient is having angina, I can say that you have what's called angina. Do you know about it? This is also one way of asking. And another way is you have what's called angina, and let me explain what it is. Just in one sentence, you have to tell the patient what it is. You don't have to go in much detail. Okay. Another way to explain about the condition, you can use it this way. It is a condition caused by this thing. The symptoms include this, and the best treatment is this. So based on the diagnosis and based on your task, you can choose the statements from these. Next is the management. First of all, it is important. First of all, the most important thing. Okay, and it is important to do this thing. Do you think you can do that? This is now my checking for understanding. I'm checking like whether the patient is agreed to my point or not. Don't worry, if you follow my advice, you will get much better soon. This is just to give confidence or encourage the patient. So these are the management statements here. Next we have for reassurance. In most of the role plays, we have reassuring statements, like we have to reassure the patient that like you don't have to be much worried about this thing. It's completely normal, or it's nothing to be alarmed about. So this is a condition with nothing to be alarmed about. It is completely normal. So let me reassure you that there's nothing to be alarmed about it. Okay, don't worry, it will go away by itself with some days of rest. Okay, the staff here is very experienced and will take good care of you. So these are the reassuring statements. Now we sometimes have a very reluctant patient. Again and again, we have to use these kinds of statements. So try to avoid repetition. If you have used one statement at once, try not to repeat it. We have a list of statements, try to use another statement for the second time. So you don't have to get angry with the reluctant patient. You have to be very kind, and you have to like console the patient as much you can. I really appreciate your concerns. I can understand your worries. I know how you feel, but let me tell you, let me explain to you why this is necessary for you. If you don't follow my advice, you may suffer from this thing, or you may have to suffer some complications. So again, these are some of the statements for the reluctant patient which you can use. Next, checking for understanding, as we have already discussed. Is that clear? Am I clear so far? How does that sound to you? Do you think you can do that? Do you have any questions so far? And then are you following me? All these questions are understanding questions. Okay, first of all, it is most important to do this. I have to highlight or emphasize the importance of this. This is used when in some of the task points, you're given the point like stress on the importance of exercise maybe. So it starts with like this, emphasize the importance of this thing. So in that case, you can use these kinds of statements. If you want to repeat any point, which maybe you have mentioned at the start of your conversation, and at the end or in between, you want to repeat that information. So as I mentioned earlier, or as I told you earlier, you can repeat that point again. I would recommend you, I strongly advise you to do this thing. So this is for the advising. Sometimes we have bad news, which we have to give to the patient. That is, maybe the patient is suffering from cancer or any such disease. So we can have the test results back, and we have the test results back. And sorry to tell you that the cause of your symptoms could be more serious than you think. And then you can tell the diagnosis. Okay, I can understand it might be very stressful for you, but let me tell you about your diagnosis, right? So you can state it like this also. I realize that this has come as a shock to you. Okay, so these are the statements for the bad news, and we have very rare cases for bad news. Most of the time we have normal conversation, like it might be the emergency case, it might be a simple ward visit. So bad news, rare, but you can have it. The ending. Do you have any more questions? Is there anything else bothering you? I would like to see you in a week if the follow-up is mentioned in your role play. I hope you feel better soon. Wish you a speedy recovery. If you have any further questions, please do not hesitate to contact me. All these for the ending. That's all with the speaking part. And if you all have any questions related to writing or speaking, please proceed with your questions. Thank you, Dr. Mutaz. Any questions anyone having related to writing or speaking, anything, please feel free to ask. For the speaking part, let me tell you one more thing. We have around 50 to 60 role plays, maybe more than this also sometimes. And most of the time, one of them gets repeated. So it's good to practice with all of them, and we include all those in our course. So we can like practice as much as we can. And about the writing also, around maybe more than 50 writings we have. So when you're practicing so many writings together, so it's very easy for you to go for the exam after this course.
Members have got it today. So thank you so much to Dr. Iffat and Dr. Sara, our respectable mentors. And now, shall I continue with the course? Because we have been receiving many queries and we need to discuss with students. So, welcome all of you once again. This side team med exam expert, and yeah, about OET course, we have received many queries that how we do the things or how we help the students. So, here on your screen, you have some points visible. We have just wrote them down for you. That in our course, we will provide live Zoom sessions. All right, your classes will be through Zoom app. That's easy option for everyone to join. Then after live classes, we provide recording of these sessions on our website as well, right? I will tell you how to log in or how to create a sign up on our website. That's also a very easy procedure. Then we provide letter corrections. As Dr. Sara was here, so she is one of our mentor. She always, go with the writing part of our OET. So she provide letter correction with proper marking. And after letter correction, we have one-on-one sessions as well. So in a month, we try to cover 16 sessions in which you will get to know about all the 4 subtests. And besides those 16 sessions, we also give one-on-one session, 2 for each participant. Like you can get 2 more sessions. What is the difference of live Zoom class and one-on-one session? It is just that through Zoom class, you will be with all other participants in that course, but in one-on-one session you will be there and one mentor of your choice will be there, and you both can discuss on any of the subtests and clear your all queries on that one-on-one session, right? So we provide some practice material and we just make it we have just extracted some data from official site of OET to make it look like a real exam environment, and we have such questions which are just like OET official test, right? So it is on our website as well. Recently we have also made a study room as well, and it is on Telegram, a group in which you can discuss with other students as well. So this is a brief intro of how our course look like. So moving to next part, we have the second most important query is that what if someone needs a help more than different different pace require different time to consume the things. So do not worry about that, because at Med Exam Expert we have a proper schedule and we will provide you a weekly schedule. We will at our side we will plan all the monthly schedule, and each week we will give you the chunk of that schedule. It will be organized and you will get to know before your class that you have the particular class on that day, right? So if you're a beginner, and you think that you need more time, so you can see that we have two planes, 1 month plan that is called a silver plan and 2 month plan that is called a gold plan. So these are basically, just the two dimensions to give you that either you can go for 1 month or 2 month. But if you think that you need more time, we can also, help you with more long time after the 2 months if you think that you need more practice, right? So of course, if you will join us and you will need more than 2 months, of course the team will love to give you amount of some discounts as a good omen, good sign. So basically, if you are slow with the pace, do not worry about this. We will be providing you good discounts as well, right? So moving on to the next thing, we also received the queries that all right, you are giving the course and you are also providing all the materials, so who will be your mentors and what are the little details about course? So first of all, let me tell you that tomorrow our January batch is starting, or December batch has ended, and January batch first class is tomorrow, right? On 3rd of the January. So who will be your mentors? First of all, the two mentors who took the session today, Dr. Iffat and Dr. Sara, they are our mentor. And the third one, our new mentor, he had just joined, and he is also a very superb mentor. He's nurse, registered nurse by profession, Mr. Sajad Ali. He's also a very good mentor. And about the course, we usually get the query that who can join, like even nurses can join, doctor can join, all the healthcare professionals who are allowed to sit in the OET test can join the course, because we have doctors, these both doctors are from different domain, and we have a nurse as well. So the course team or the course mentor are diverse, and anyone from the healthcare profession can join. So until when is the course accessible? Course live session for that particular month will be 16, but we always provide the recording of these things and these session and the practice material until your exam, right? If you have exam in 18th of Feb, but you joined from 1st of January, we won't be taking away your access for, until your exam is done. So it is also a plus point that you will get all the thing to revise again and again, right? So, and next thing is a simple question that mostly people ask: how to enroll our OET course. So it is very easy. We have a website. You need to create just your login. It's a simple sign up with your email and your password. Then you have to select your course which you want to enroll, like 1 month or 2 month, and then make your payment, and then simply you are enrolled with us. For all the details and how to go through the course and all that, I will be there. Team Med Exam Expert will be there to help you all, and we will provide you all the assistance on daily basis. We will be taking feedback from you. Also, we had taken feedback from our current students, and they are very happy and satisfied with the mentors. So this is the thing. These are the steps with going with OET course right now, and we are trying to cover each and every dimension. We are open for suggestions as well, for your queries as well. You can ask anytime. So just winding up, and we have a good news that we will be providing a group discount. So moving on to that, OET group discount, we have just got many queries that it's a new year, so we need to show some gifts for the audience as well. So right, we have OET group discount as well with us. So yeah, about the cost, let me come to that part. I will definitely share it with you. So the group discount, we have given like a new year gift for all of you. If you are a group of 2 students, you will get $25 off on any of the course, like 1 month or 2 month. And if you are a group of 4 students, definitely you will get more discount. So it's kind of amazing thing. You can take in your friends as well, and we can join. We can have a proper study together in a good group and in a good environment, right? About fees, yeah, I'm just coming to that point. Yeah, so I'm sorry, I'm not able to see your name, but fee, basically for 2 month, or first of all, come to 1 month. For 1 month, we charge $200 for all the features, like live sessions, recorded session, letter assessment, one-on-one session, all feature including in that package. We charge $200 for 1 month, and for 2 months, we charge $325. But if you will join within these first week of January, it will of course you will be given OET discount, and you will get this discount. So I have mentioned that in previous slide, OET new 22, that is the coupon code. You can use that as well, and if you have any problem, we can help you with we can help you, and we will help you enroll in the course. Do not worry about that. Personally, I would recommend and suggest everyone to join, because mentors, they are very, very dedicated people, and they are a very good addition in our med exam expert family as well. So do not worry if you want to join. You can join easily. Yes, OET basically, I have just got the query, that is OET exam online. Yes, OET is available in online format as well. Basically you have three kinds of option for OET. One is online from your home, sitting in a comfort zone from your home, and then second is nowadays is on computer assessment in the test center, and third is paper assessment. So you have three options. You can go for online as well. It's that you can just give the exam while sitting in your home. So that's the good thing about OET. So I hope that you have learned, and the Team Med Exam Expert is so glad to have you people here today, because it's good to conduct these sessions and get to know each other. So we are very well. Thanks again, and thank you so much for joining in. We will be winding up. For any queries, we shared our number. You can always contact us. You can just send us message. You can WhatsApp us, and even you can just go to our different social media platform or YouTube channels or Facebook pages. We have been here like in the platform of e-learning for past 6 years. So it's been a good long journey, and OET is our new chapter. So we wish you all to join us as well, and we are here for you. OET, OET is almost, there's exam is held like 14 or more times per year, so you have a good chance to attempt like whenever you want. It won't be a problem as well.